For Rehabuddin, and I'm the nursery manager at Uptown. Today we have Dr. Mina with us. He's also a founding parent at the nursery and a very experienced pediatric dentist.
Thank you.
And he's here to talk about children's oral health. If you have any questions, you will get a chance to ask at the end of the session. Please welcome Dr. Mina.
Thank you, Ms. Faria. Good morning, everyone. I'm Dr. Mina Sharabim. I'm a pediatric dentist. I'm also, as Ms. Faria has said, I am a co-founder, or not a co-founder, a founding parent of the nursery. So I'll just introduce myself briefly again. So I am a pediatric dentist since 2012. I work currently in Cosmo Health Mirdif in Mirdif Avenue Mall. I treat children from the ages of 0 to 12. I'm also specialist in treating people of determination. Our clinic is well known, and especially me, for digital and painless dentistry. For example, we don't use injections anymore. We use the computerized injections. And I'm Hope's father. She's the second year now in nursery, Uptown School nursery. Okay, so today I will just tell you why it's important to save our children's teeth. Yeah. So this is just like a brief, like in general, teeth is very, very important, not just it's just like, see, it's for your health, for your early development, for your nutrition, for self-esteem, for academic performance, for prevention of early teeth loss, dental fear and anxiety, and cost saving. So as we all experienced through Corona, I think everyone was sure that Corona, that they were always saying, eat healthy, eat healthy. If you don't have proper teeth, you will not eat healthy. For example, I had a patient, she was not eating well, so her health was not fine, and she was not able to express that she's in pain. Once we treated her, like I remember the mother said, I begged my child to eat. After we treating her teeth, now she's begging her child to stop eating. So you see the difference? Second thing, for the academic performance. This is very important when you say academic performance, especially like by research, by experience, we see a lot of kids missing their school because they are in pain. So if you, like, again, I always say prevention is better than cure. Yeah, why it's important to save the baby teeth? It helps the child to chew. It helps, which again, as we said, when he eats or she eats, means she's healthy. And we have a very good example. It was Corona. Corona, we will all advise, please eat healthy. Please eat healthy. How can I eat if I don't have proper teeth? Yeah, appearance and self-confidence. I'll show you a very interesting slide about that. Also, prevention. We have the concept that a lot of people, it's primary teeth. Why should I save it? You should save it because the baby teeth usually stay till the age of 12. The early loss may lead to also problems in occlusion and problems in appearance, and may also need orthodontic treatment, braces. Yeah, speech, FLMN. Okay. Avoiding pain, as we said, when you treat it early and when you do your 6 months checkup, you avoid pain. And cost saving, and I'll show you a very interesting slide, and improved quality of life. Yeah, this I think all ladies will agree with me. See, what people notice first when they meet someone. Okay, it's for kids, it's for adults, it's for everyone. Yeah, see, 47% is your smile. Cheese. Okay. Eyes 31, smell 11. Just to make the maths easy, I'll make the smell 10, because 5% comes from the smell of your clothes, 5% comes from the smell of your mouth. 47 plus 5 is 52. 52% comes of the beauty comes from someone place. Cheese. I'll tell you a funny story. My sister refused a guy before becoming a dentist because his teeth was not good. That's a true story, believe it or not. Before being a dentist, okay? And of course, girls have different opinions. So this was a 4-year-old. He did not have teeth. We restored his with his teeth. Yeah, this is a 4-year-old. This child was not smiling. He was not interacting in class. He was not eating. Okay, this is not a Google. This is one of my patients. Yeah, see, I'll just repeat, SL. If he doesn't have these, how he will pronounce it? So that's why he was affected. His speech was affected, and he didn't want to go to school. He was not participating in class. Even in the family gatherings, he was not smiling. Now he couldn't stop smiling. His teeth is back. His teeth is back. So it's very important to save the teeth. See, another. This is, for example, this. She was 9 years old. She was not brushing. This was just simple cleaning. This is a lot of people think this is whitening. This is not whitening. We don't do whitening till the age of 18. This was just simple cleaning. Look at the difference, especially if you have teenagers. Of course, you know how teenagers. We all know how teenagers think and they care about their appearance. It's just simple cleaning. This girl did not do her cleaning every 6 months. It's just, it's from iron. It's from urine. It's from iron or vitamin D. And sometimes it's not that. Sometimes it's just some people have chromogenic bacteria, which is the bacteria that makes stains. So for in her case, it was not iron. It was not vitamin D. It's just she did not brush. Her bacteria is strong. She has a type of the bacteria that makes stains. So that's why we recommend to see us every 6 months and to recommend also an electric brush. Okay. See, I'll just the orthodontics. Saving primary tooth is very important as we avoid space loss, and this video will explain it to you now. If you have space loss, you might need braces later, and sometimes we also need to extract healthy permanent teeth to gain space again. So it's very, very important to save the baby teeth. You see these 3 blue colored teeth, okay? This is your baby canine that falls at the age of 12. This is a baby canine that falls at the first primary molar that falls at the age of 9, and this is the second primary molar that falls at the age of 12. Okay, and this is her permanent molar that comes at the age of 6. Yeah, this usually erupts around to 1.5 years when the baby is 1.5 years. This comes around at 2, and this around 18 months. So the baby has a long way to go. I just want to show you the video. And as I told you before, that if you lost the baby tooth, sometimes we have to extract the baby tooth. I just want to play this video. Yeah. Yeah. Look, let's imagine we lost this tooth. Look what happens with the teeth. It starts drifting, and there is no space for that teeth. And if you do that, if I'm lucky and I have this tooth, I can do the space maintainer. Again, that's a cost. That's a cost. So prevention, please remember, always prevention is better than cure. You see? Can I repeat this video again for you? See, this falls by the age of 12. If I lost it early and if I'm lucky, I have this tooth. But what if I don't have this tooth? Where I'll put my space maintainer? And I see this a lot in the clinic. They come at the age of, unfortunately, 5. I don't have this permanent tooth, and I cannot put my fix. So we will need braces later. Okay, cost saving. Now, I'll just hit numbers, yeah? If you come to a dental clinic or for a child or an adult every 6 months, you just come for cleaning, that's okay. Now you have a filling, it will increase a little bit, just a cavity. Now, if it's very deep, it will need a root canal. Even kids get a root canal, it's not just adults, which is more. If it's too much, if the teeth is totally destroyed, we have to extract. If it's a permanent tooth, we go for an implant and a crown, which is very expensive. Even for the kids, then it will be more expensive because we might need to do braces again, as we have mentioned. So what causes cavities? There are 3 main factors for causing of cavities. You have the first factor is the bacteria. This we cannot control. Someone has strong bacteria, someone has low bacteria or weak bacteria. Like, subhanallah, someone who gets quickly sick and someone who takes time to get sick. This is out of our hands. It's just a type of your body. Yeah. Oral hygiene. When we say oral hygiene, it's many factors. It's how many times you brush your teeth, the way you're brushing, the toothpaste, the mouthwash. If you're using electric brush, the tongue scrubbing, flossing. Flossing is 40% of your cleaning. Okay. So just now the diet, and the third thing is the diet. So when you say diet, we just recommend, this is our recommendations for the diet. So again, excess sugar, candies, gummy bears, all this. Enamel quality of the teeth can cause caries. Some people, subhanallah, their enamel is a bit weak. So it's their body type. You cannot control it. Yeah. Dehydration, if you're not drinking water is, especially in Dubai, you have to drink a lot of water. Yeah. lack of fluoride intake. And this is a myth going on now that we say that fluoride is not good. That's not true, okay? All the patients who come to me who are using non-fluoride toothpaste, they have cavities. They have cavities. Please use a fluoride toothpaste according to the guidelines, okay? And I'll explain it to you now, okay? And irregular oral hygiene measures that, for example, you or our child is not brushing twice, he's not brushing for 2 minutes, he brushes one day yes, one day no, that's the fact. Always remember, bacteria needs 24 hours to cause cavities. So if I brush today morning and I brush in the other day night, sorry, in the next day, that's the next day morning, it's 24 hours. So it's accumulation. So you got it, right? So the more I accumulate, the more I have cavities. And especially this generation, mashallah, their teeth their bacteria are very strong. Okay? Can cavities be? It's not only diet. It's not. Remember, it's three factors. It's diet. It's the oral bacteria. This generation, we have two challenges. Look, I'm not talking as a parent. Sorry, as a dentist. Now I'm talking as a father. Okay? So you have two main challenges. Is you have the diet. The sugar, the candies, all the gummy bears, they stay in the mall. I hide my daughter and run. I know what you're talking about. Okay, so I'm talking as a father now, not as a dentist. Okay, and you have then the challenge of brushing. So it's these two. You have a challenge of the sweets and you have the challenge of brushing. Yeah. So can cavities be prevented? Yes. Just always remember, prevention is better than cure. Start brushing as early as possible. Believe it or not, from day one. I always, from the first day when the baby is one, not just brush, just with the wipe, like there's a silicone brush and you just brush it. Yeah. Be a good example. Be a good example to your child. Monkey sees, monkey does. صح? Who's our example to our child? It's us. If they see you brushing twice, they will start brushing. Okay. I always tell to the parents, especially the ages of 6, even my daughter 2 years, she wants to brush. I let her brush, and then I tell her, you know what? I will brush for mama. So I literally brush for my wife, and my wife brushes for me, so she understands it's okay that to help each other. Okay, and positive reinforcement, like when she does something, bravo, good girl, good boy, we are proud of you. Yeah. And involve an ownership. Involve her. Which toothbrush you want? This or that? You want which toothpaste? This or that? They get very happy when they choose to be part of it. So this is my daughter. See, she was almost 3 months. See, this was 18 months almost. See? Now she's 2 years. Now she comes. Yalla, hope, brush. She runs, and she opens.
But in this age, what about the toothpaste?
Even if they swallow it, it's fine. We always say you put like a rice pea. Until she's 3, you put a rice pea, a rice-sized grain. Sorry. When she's 3, you put a pea size. حبة البسل. Okay. See? If it's fine, ما هي حتى لو بلعتها, it's fine. It's fine. It's fine. It's very safe if you use the correct guidelines. So how old is your daughter?
She's about 5.
Okay, so about 5, we say like 1,000 ppm fluoride. For example, you have Curaprox. You'll find it on Amazon. Curaprox 2+. It's 950 ppm fluoride. It's very good. Okay. Also for kids, for example, if your kids are not if they are, let's say, 6 or 8 years old and you have this challenge, it takes about 5 to 6 weeks, sometimes 8, to develop a new habit. So what do I recommend? Get this is a chart, okay? And for example, in the morning you brushed a tick, another in the night you tick, yeah? Promise your child, when you finish the first week, I get you a small gift. Second week, you get a small gift. Third week, you get a small gift. 4th week, you get a small gift. A fifth week, you got another gift. When you finish the whole thing, you get a bigger gift. I'm not talking expensive gifts. I'm just talking something simple. After 5 weeks, it becomes a habit to the child to develop to brush his teeth.
But my kids start brushing in morning and evening, but they have also yellow teeth.
Yellow is what when you say yellow, it's normal. So when we studied in dentistry, our base is yellow brown. When you say yellow, it's okay. But I mean, like, what kind of yellow? Is it the normal yellow or the stains yellow? Then this is her, subhanAllah, that's the normal color of their teeth. Yeah? How to prevent? It's simple. The rule of 2 by 2. You brush 2 minutes, 2 times per day. Once before breakfast and once before you sleep. Okay? And brush twice per day. Floss daily. What I recommend is a water flosser because it makes life everyone's easy. Ladies will not like it because it makes a mess in the toilet. Okay, but it's 40. But remember, flossing is 40% of your cleaning. Okay. Use electric brush. Why do I recommend the electric brush? For 2 reasons. First, I recommend the Oral-B, the electric one, the chargeable, not the battery, because it runs faster and it also has a built-in timer. It brushes for 2 minutes, and the timer is split into 30 seconds. So 30, 30, 30, 30. That's 120 seconds. That's 2 minutes. Yeah. Use a fluoride toothpaste. So here is the guideline. So if you have a child 0 to 2, it should be 500. If you have 2 to 6, it should be 1,000. If you got any toothpaste, just read about it. You'll find these numbers. Yeah. If you have 6 and above, it's 1,450. Usually, this is an adult toothpaste, and even for kids. I'll give you an example. Sensodyne, for example, 6+.
But we can trust the toothpaste in supermarket. They label with the age.
No, unfortunately, no. You have to read these numbers. You have to read these numbers. If you want, you can follow me on Instagram. I'll show you my link, and I have the link what products I do recommend for according to the age. Yeah, use a mouthwash daily. Now, it's recent researches. Mouthwash is very, very important. Tongue cleaning, healthy diet, and regular visits every 6 months to the dentist. Yeah. And apply a Fisher sealant. So one of the best. This is a recent product in the market. It's natural. It's very safe. Even if you have a baby that's one day old, even if it's swallowed, it's very safe. And you see, this is a research. You see this the blue one. The blue one is the control. So it's without using the mouthwash. This one, the blue one, is with the mouthwash. Ideally, I want a pH of 7. You look after using the mouthwash. Look how the pH have increased. So this will help me to decrease the bacteria inside our mouth, which means decreases the chances of my cavities. Okay. Why is it important to visit the dentist every 6 months? This is not only for kids; it's for all of us. Yeah. Visiting every 6 months helps to detect us early the problem. The early, the better, the less money. Okay. Again, please, the better, the easier. The less money, the less complication also. Yeah, and if for the child, when it's just a simple cleaning and simple filling, it is less challenge for him, and it's less an anxiety. Imagine if the patient has to go for an extraction, it's not nice. Come on, we adults, we don't like it. We don't like it. Imagine. Yeah, and for the age of 7, we always recommend to see an orthodontist. Okay, a braces doctor, and I'll show you why now. Okay. This is just a simple example how to prepare your child. So the first thing, always take your child on his first birthday to introduce the dental. We call it the dental home for your child. Yeah, watch your words, please. We have this mistake, especially I'm talking about the Egyptian culture. If you don't brush, I will take you to the doctor and I'll give you an injection. We are blacklisted, and then they hate us. This doctor is the bad guy. He's used for punishment. And we suffer, to prove it opposite. I had a child. I'll tell you a very nice case. I had a child. He was 4 years. He entered the room. Doctor gave me the injection. Let's go. We're done. We did the root canal. We did the crown. We did everything. Next visit was an extraction. He did not enter from the room. Why? His brother told him the doctor will get a hammer and he will knock the tooth out. Who will believe, me or he knows his brother, he doesn't know me. So please watch out these words. Do not threaten your child. Do not you and even when you're in the dentist, don't ask him, do you feel pain? He will start thinking, what's wrong? Why am I not feeling? Then he panics, and then he will start. He might not feel pain, but you know what? Baba said pain, so I should feel pain. I'm in trouble. So please watch out your words. Yeah, and again, do not threaten with the word injection, or we will give you an injection and we'll give you a surgery. People use this, and this is very bad. Okay, positive reinforcement. Okay, bravo, good job. And sometimes if the child needs to relax, and we might give him the happy gas, or if it's too hard, we have to put him to sleep. But we usually start with the nitrous first. Yeah. Why it's important to detect, to see the orthodontist at the age of 7? Again, early detection, better outcomes at shorter times. Okay, orthodontist can reduce the risk of tooth decay. Imagine this is like a healthy smile like this. If I have tooth one covering the other, the food gets stuck between their teeth and they have cavities. So yes, braces will help to decrease the chances of cavities. Yeah, speech and breathing problems. People who have a narrow jaw, sometimes they cannot breathe properly. I refer a lot to case either orthodontist or sometimes to the ENT. I just check their tonsils or their airway. I just ask two simple questions: does your child snore, and does he's a mouth breather? So I just ask these simple questions. Yeah, and also early detection helps to fix the jaw. I will show you an example. It will explain more. Yeah, and see, even the American Association recommends to see the orthodontist, the braces doctor, at the age of 7. Yeah, just a simple. This we have two kinds of braces. We have three kinds. So we have the normal braces, we have the wide braces, and we have the Invisalign, the removable one. And this now is the smartest, fastest, cleanest, easiest. Because this one, we don't limit your intake of food. We don't. It's easy for cleaning. This one is a bit of challenge. Certain foods are avoided. It's harder to clean. Yeah. Look, this is we call it a cross bite. So this is my normal bite. In this kid, it was the opposite. We call it cross bite. It's like this. See, look at my jaw. This is my normal. If I don't treat this early at the age of 7, what happens is that his jaw will grow in the wrong position until the age of 18. And sometimes, if it's not treated early, sometimes you have to do a jaw surgery to correct it. Early, again, prevention is better than cure. Yeah. Again, this is another patient at the age of 7. Look at the crowding, and this is after braces. Yeah. And thank you for listening to me. Any questions? I'm willing to answer. Please.
You mentioned before about water flossing.
Yes.
What do you mean about water flossing?
So it's like a water pump. It's like electric brush, but it's a water pump. So instead, we have the normal flosser where you go like. So it's just a water pump with high pressure. It goes cleans between the teeth.
Where can I find it? Can you show us?
Ms. Fariha, does have internet connection?
It's also called a water peak, right?
Water Peak, yeah. Water Peak is the brand. Water Peak is the brand. It's connected perfect. So here's my Instagram. So here's the link that all the products. Oh, it's not showing. I'm sorry. Uh, no, but it should present. Yes, here we go. So this is my Instagram, okay, and here's the link. So I'll just show you. So this is a water flosser, for example. This is the brand. No, the beauty of this one. So the beauty of this one, you see this head. It's changeable. It comes with 4 pieces, so 4 people can use it. Yeah, and if you want to do the maths, this is more cost saving, because usually if you buy a water, or if you buy a normal floss, it's around 15 dirhams. For one person, it stays for 1 month. So if, let's say your average of 2 or 3, yes, this is a lot easier. This is a lot easier. So if you do the maths, for example, the floss is 15 dirhams. If you have 3, so it's you, your wife, and your son or your daughter. So that's around 45 times 45 into 12. That's around 300 and something. This is 280 after the discount. When you put the code Dr. Mina, it becomes to 250. So that's 250 for the whole family, and you get a 1 year warranty with it. Yeah. For you're asking about the toothpaste. So here's the toothpaste. So again, for the electric brush, if you want for the girls, and then for the boys, because the boys Star Wars. Yeah. And then Amazon has a very good offer, actually, to be honest. If you have adults, it's the bundle offer. So these two are for 165. You get two one. Yeah. And then for the toothpaste, see, for the children of 2 years, you have this one, Curaprox. Okay. And now for yeah, sure. Yeah. See here, it's written 950. It's written somewhere. Yeah. Yes. Sure. Sure. Yeah. So I just want to show you the guidelines. Sorry, not this one. Yeah. You see, I was telling you about the age. So it should be 1,000 ppm flow, right? So this is 950 to 1,000 is not a big difference. Okay, but this is the one what I'm recommending according to the age. Yeah. And then you have for the 6 plus, you have the mint flavor, you have the watermelon flavor. It's 1,400 for the toothpaste. It's 1,450 for the toothpaste. Okay, and then you have the mouthwash. You have the mouthwash. Okay, and the electric brush. Yes. Yes. I have a surprise for you. I'm giving you a sample. I'm giving you a sample today. Yeah. And if you have babies also, like, see, this is a baby brush. It's a very nice brush. Mm. Sorry? Teenager, if you have a teenager, so this is for babies. This is the one you saw that I was using for my daughter. Yeah, and this one, when she starts teething, I recommend also this one, the toddler brush. This one, sorry, not this one. This one. Okay, they have changed it. So there's another one. Yeah. So you were asking about the teenagers. The teenagers, you can go for that one. For the adults, they are considered adults. So this one. Yeah, or the electric brush. I still recommend the electric brush. So this one. Sorry? Philips. Philips. But the problem with Philips, I don't recommend Philips just for one thing, because it's not rotating. I love the Oral-B because it's rotating. It rotates. If there is another brand, they have anything electric?
So suppose you don't have it, so then you can go to some mothers, because I'm his colleague and I'm a root canal specialist. So some mothers also tell that doctor, I don't want an electric toothbrush because I don't think he's cleaning well. So what I tell the patient is take a manual toothbrush as well and
Move in circles.
so what happens? It cleans the tooth, but it also massages the gum in the process. So, and then, that's how they understand, okay, it's not. One more thing is, as Dr. Tina said, that, and I was asking about brushing hard, he said, my teeth are yellow. What we don't realize is brushing hard is actually wrong. It makes your teeth more yellow. Why? Because your first layer is the enamel, which is white in color. Your second layer is called the dentine, which has the nerve endings, and it's yellow in color. So the more you brush hard,
The more you erode.
and you're moving your gums up.
Yes.
Exactly.
And sorry, doc.
Sorry. Most of the manual toothbrushes, they do this and we do this. Both are wrong. Why? Because when you do this, you hit your gums and your gums think, oh, okay, this is not my normal position. And every single day, it starts receding up and down.
So another thing, we always recommend use a soft brush, please. We have this misconception that the harder the brush, the better it cleans. No. Please. No. It's we call
Exactly.
it's either ultra soft or soft.
Yes.
Because the harder the gums, as the Dr. Sushma said, it goes up. Your gums goes up. Yes.
Also the gums breathe a lot.
Yes.
Yes.
And what happens is people say they have bad breath, but that's because your gums are bleeding. So dried blood smell is also can lead to bad breath. So that they don't understand. And even when you talk about flossing, when you said string flossing, we have a big challenge. So sometimes I tell my patients, please stop using the floss because you're causing more issues. So what happens? All our teeth are at one point very tight. So when we try to put the floss in, it snaps. So patients think, okay, fine. But what you don't realize is the food that's stuck there, you pushed it in, you pushed it into the gum, and now it doesn't have any place to come out. So they do this and then they do this. So it has caused, we've seen a lot of cases where there are decays started under the gums because of this.
So that's why we recommend the electric brush and the water floss, because it goes in circle. It goes in circle.
So just to give you a small story, that electric toothbrush was actually introduced into the market for kids and people with Parkinson's. Why? Because they don't have a control over things. It has come more now to the kids because the kids really still don't know the. So if we tell them brush in a circular motion, they don't understand why they're doing it in a circular motion. So for them, till we get them into the practice, we recommend electric toothbrush so that they know, okay, this is how it is. But if they do switch onto a manual toothbrush, you can also advise them that move it in a circular motion because that's the way you brush, not.
Plus, also why we recommend electric brush for the kids, because the rule is they don't brush alone until they are 9. Why? Because the motor skills of any child is not fully developed until the age of 9. So what I usually do, I tell the parents, hold the brush, let the child hold the brush, let them brush the way they want. Tell them, I will help you. The child will accept, I will help, not do for you. Okay, you hold the brush and then you hold their hand, and all you need to do for the brush is to guide the brush. So the electric brush will become easier for it. It will help the child. It will become easier for you to brush the teeth for your child.
What about ulcers? My daughter gets ulcers every other week, and they're really big and but makes her.
Ulcers have two main reasons, or a couple of reasons. The first reason is stress. Believe it or not, yeah. I have a child. She was stressed about, especially with all the things that happening in the world. And before that, I had a child. This was 2 years ago, and he came with an ulcer. He was stressed. Why? What will happen if World War III came? He was 7 years old. So the first thing is stress. Second is maybe he has an upset tummy. Sometimes if you have an upset tummy, sorry, if your child is burping a lot or he has a bad breath, sometimes it's not from only the teeth. Maybe it's something in the tummy. And third, also it's just hormonal changes. And another thing, also maybe if he eats something spicy or chips that have cut his gums or his like floor of the mouth or the tongue, or if he is entering an infection or he just left an infection. Like if he was sick, for example, the last week, for example, if he was sick, he's recovering from the infection. Usually, you will get some ulcers after the infection, or entering or after the infection.
Because of vitamin deficiency also as a contributing factor and probiotics. So when you really put this, I'm talking about teenagers, kids is what Dr. Meena said, but teenagers, what happens is because they would have been sick, they would have had antibiotics or something, it kills the bacteria in the tummy. So you need to replenish it with vitamin B, usually is what they do, so vitamin supplements and probiotics. So that will also help with the ulcers. And we have some products as well,
Yeah.
which are very good for the ulcers.
Is there any toothpaste for adults which is acidus free that you would recommend?
I think now most of the toothpaste, like the one SLS free, are Curaprox is SLS free.
For adults?
Yes, they have for adults. Also Curacef. Yeah. Cure.
Previously called Zendium, but now it's not.
You mean Elgidium?
No, Zendium. There was
Xanium is not. Oh yeah, yeah. I forgot. Yeah, it was been for a while in the market.
Now we have Dentucryl.
Denticral.
Also SLSG.
Yeah, even Curacef is even
Pharmacy or
no pharmacies. Even the Curacef is in the pharmacies.
We normally recommend people to buy their dental products now from the pharmacies because you have a range. You have something which is anti-caries, you have something only for the gums, only for the sensitive teeth. So what happens is focused on your problem. So we do have an overall, toothpaste for daily use for people who don't have a dental issue. But there are some where, suppose someone who has a bleeding gum, why will I give them sensitive? It doesn't target your problem.
So it depends on your problem. So this brings the topic. Please visit us to guide you.
Yes, it will help you. It will help us to tell you what your problem is. Then we can recommend products. Then you try them yourself, and then you can buy them. So that's.
And sometimes we tell you have to go for this product first, and then you need to switch. So we are targeting a problem, and then we tell you, what, I want this to be your day. So for example, that mouthwash that we're really giving you, this you can use it daily. There's no harm side effects. Other mouthwashes will say only use it for 10 days because it causes stains. So that's why, and some mouthwashes also has alcohol, and some mouthwash will also cause dry mouth. So this one is natural. You guys try to love it.
Like Listerine, like many of them buy.
Listerine is not our favorite. Listerine is not our favorite.
Normally not recommend. One, you can, but it is again chlorhexidine. So chlorhexidine, there have been studies saying that it stains the teeth over after 2 weeks of using. So again, I understand the antibacterial efficacy, but you have other products which are alternative to chlorhexidine, which gives you the same antibacterial efficacy, but it doesn't give you the side effects of it. So we normally recommend other products.
So that's why, for example, when doctor said chlorhexidine, we only advise it for people, for example, have excessive bleeding, and we only tell them for 2 weeks, and then you switch to another one. So that's why we always please ask your dentist which toothpaste, which mouthwash you go.
Instead of injections they're using now?
We have something called STA, single tooth anesthesia. Yeah. So we do it. Long story short, what pains the adult and the child is that if you're using the normal injection, the speed of the injection that hurts and it pricks. The STA is computerized. It goes 1 drop per second, and we don't prick. I go between the teeth. So the child will accept a push. So when I go to the child, I'll tell him, you know what? Especially boys, the shoulder rule of football. I will just give you a shoulder. It's not a foul. Okay, I'll tell them you will just feel a push. The child will accept a push. He will never accept a prick. No, it's a computer. It's a computer. So it's.
And we can use them for the kids and adults, especially our patients.
So see the mouth breathing. So I'm just showing this child. I discovered here. Look at his tonsils. Yeah, I discovered it. She thanked me later. Now, because of the mouth breathing, he had his jaw have moved front, and he went to the NT. He said, "You have to remove your tonsils," and he improved the breathing. Because I'm not signed in. So it's like a machine. It's a computer. So I call it a robot because I just press with my finger. It's a needle, but I don't prick, and it goes 1 drop per second. Yeah, but it's a needle, but I don't prick. Look, the needle I prick like this. Okay, it's an injection. This I don't inject. I just go between the teeth like that. Sorry?
So the gums,
It's pressure, yes, it's pressure. Dr. Priyanka, can you just show the Instagram? If you go to my Instagram, please.
so
I'll just show
basically
Mama.
STA is now, you see the gums. The gum is like a collar for your tooth, right? So we place this between the collar and the tooth. So so patient doesn't feel the pain. It's just that so the
Oh.
but
Yes.
what happens, every tooth is enveloped with the gum, which has a very thin gap between them. So we anesthetize through that gap to the tooth. I know, exactly. So it looks like a pen. It looks like a pen. So he'll show you the video. So it looks like a pen. So the patient doesn't understand. Even us as adults, we don't understand. I do sometimes root canals with just this. We don't give them. I have patients come say, Doc, after you do a root canal, can I go back to work? Yes, you can. Why? Because I've not anesthetized this entire jaw, or this. I've only anesthetized one tooth. So you're not like, you can't feel this area. No, it's not that. It's not that. Yeah,
So this is just a video explaining the water floss. So okay, I'm just showing you the STA. There's a video. I can't find it.
No, not in the clinic. But we can
بصراحة مش كل العيادات بتستعملها يعني هي the problem of the STA that it takes time to يعني it takes me 5 minutes to give the anesthesia. Some people they don't have the patient, but anyway I tell the doctors like even if you use a normal injection you will still have to wait 5 minutes to work. This one, the STA, I take 5 minutes to give the anesthesia and it immediately works. So instead of the time of waiting, I will take the time to give my injection or my
The whitening toothpaste that we see, the whitening one, yes. What should I say about it?
So whitening tooth
yes, we do.
it's a very slow process. So what happens is that every day
Yeah, sure. I'm aware of that.
you see the results.
We always yes.
You don't have additional.
I can't find the video.
Like you have
Can't find the
cortisol,
STA video.
It helps combat that everyday pain. Some patients it does help because what happens is they have outward pain, but some patients they have inner scaling of the neck that doesn't change. So there's something called fluorosis stains, which is basically like brownish stains on the teeth. But people think it is because of the